When I first took my kinesiology class, I learned that the rectus femoris is a two-joint muscle that crosses the hip and also the knee. And what it does is it helps flex the hip but extend the knee, right? But when I was in undergrad, I just said, okay, I'm just gonna memorize that. All right, like it's a two-joint muscle, that's cool. But then when I got into DPT school, I realized how much of a factor that plays, because now when your hip flexors are tight or that quad, that rectus femoris is tight, you might have some compensations where you're arching your back because that guy is so tight from the origins and insertions. So in physical therapy, what you learn and what you'll most likely learn is that when you stretch that muscle, sometimes your lower back pain disappears. And when I was in undergrad, I didn't really understand that. When my teacher told me that, I was like, alright, I'm just trying to get this A so I can get into DPT school. But now that I've already had that pre-learning and then I'm diving deeper in DPT school, now I really feel like I was able to excel in my understanding of just human body, anatomy, kinesiology, and all of that. But honestly, what it comes down to is, one, you just gotta get in. Pick a major, stick with it, take all the prerequisites that you need, and just get into the program. And then once you're in the program, do your best to understand, to conceptualize, and then apply everything that you learn. Because DPT school, at the end of the day, this is your career. It's not about get that A. It's not about pass the class. It's about how much can I indulge and how much can I take in this information and then apply it into my practice. Because the ones that are able to apply it into their practice are gonna be the most successful ones. And just a quick side note, you guys know that I do personal training. And of course, personal training, you're working on strength, conditioning, body composition change, all of that stuff. But you gotta look at the form. And physical therapy has really helped me understand what good and proper form is, where we're decreasing the amount of stress on other joints so that you're able to increase the potential and the performance of the muscle that you're actually trying to work. So that's just a little side thing, but in my majors and in my experience as I did kinesiology, DPT, all of that has helped me in my personal training career as well.